Informed consent means that you know all of your options throughout the childbirth experience. It is also an ongoing process, so even throughout the labor, your provider should be asking what you want throughout the entire experience, from vaginal exams to assisted delivery to how you want to push. It is an ongoing process to consent to choices in childbirth. This course will be an overview of your options in childbirth. Ideally, it will spark conversations for you to have with your provider, with your partner, and for you to decide what you want for this birthing experience. There are so many choices to be made throughout this pregnancy and for this birth. Many people are asking you, what is your plan? What is your birth preferences? I want you to pause and shake off the expectations of what you should do, and I want to acknowledge that there's a lot of decision fatigue. This conversation about choices in childbirth is to offer you your options and to guide you towards what makes sense for you and your birth preferences. Let's start with labor choices. Fetal monitoring. Your baby is going to be monitored throughout labor, and there's some options on how to do that. You have internal monitoring, typically used when we need to do a closer look at baby and in higher risk situations. The most common is external monitoring, the belts around the belly or wireless stickers on the belly. If you're utilizing a midwife in hospital or out of hospital, they might also utilize a Doppler. Another term you might hear is rupture of membranes, spontaneous rupture of membranes or SROM, or artificial rupture of membranes, AROM. This means your water has ruptured, or as we most commonly say, your water broke. If your labor has stalled, you might hear the term augmentation. That means to utilize medication, typically Pitocin, to keep labor progressing. And of course, there's the option of a cesarean, a surgical birth where they remove baby through an incision in your lower belly while you're under pain management. Let's talk comfort choices. Let's start with our environment. Think of all of your senses and how we can improve your environment to bring you comfort and peace throughout labor. For sounds, you may want music, you may want meditation, you may want silence. You may even want to consider turning the machines down or sometimes turning the machines up if they're going to bring you peace to hear baby's heartbeat or if it's a distraction. For lighting, you can consider turning the lights down, having them dimmed. You can open or shut the curtains. You can even bring LED candles. For smells, think of what you don't want to smell and make sure partners don't eat those things. But also you can curate the smell in the room through aromatherapy. For people, you can invite in your doula, your family, your friends. You can also say no to spectators like a mother-in-law or residents who are not helping the process. Your choices for medicated comfort would be an epidural, nitrous oxide, or IV narcotics. To learn more about medicated pain management, see our course about medicated birth. More holistic choices for pain management could include hydrotherapy, meaning you utilize a shower or bath for pain management. Movement is another great option for pain management. It helps to disperse the sensations you're feeling. You can sway or dance with your partner. Breath work is also a great option for pain management. Breathing in and out with each wave really helps. More info about non-medicated pain management can be found in our unmedicated birth course. Here are options to consider for pushing. You can utilize directed pushing by your provider where they give you a little guidance, or you can have space to find your groove. You can push in various positions, sometimes encouraged by your nurse, your doula, or your provider, or again, you can find your groove. As your baby crowns and gets closer to being born, you can consider utilizing a mirror to see their head, or someone can offer to help you touch the top of their head. Some people feel very strongly either way. It's 100% up to you. Some labors may require a little bit more assistance. Here are your options for assisted delivery tools: vacuum, forceps, or simply some oxygen. The choice for which is best will be decided with you and your provider. Now that your baby is born, here are your postpartum choices. Starting with skin to skin, Many birth places are doing this as standard of care. Unless baby needs some medical attention, they should be placed skin to skin with you instead of at the warmer. Next, you need to decide what to do with your placenta. Are you keeping it for ceremonial purposes, encapsulating it, or are you banking it or simply discarding it? With your Anja kit, you can do both delayed cord clamping and cord blood banking. If your partner or another support person would like to cut the cord, that is an option too. You can also decline this and let the medical providers cut it. If you don't know yet and you would like to announce the sex of your baby, make sure your team knows this so that they don't blurt it out for you. For the start of baby care, you can prioritize your golden hour before you start to do any of the procedures, including weighing your baby and getting their measurements. Those can be done after you've done some skin to skin. The common newborn procedures offered to your baby will include the vitamin K shot, the erythromycin eye ointment, Hep B vaccine, and the newborn screen. If you're planning to breastfeed, you can let baby explore through a breast crawl, or you can have the nurse help you facilitate your first latch. If you're planning to feed your baby formula, you can choose to bring your own from home or use what the hospital provide. Whatever you choose, communicate it with your provider. As your birth unfolds, many of your preferred choices can still be upheld as the birth course shifts. Exploring all of your choices in childbirth actually gives you the option for true informed consent. You now know what's available to you to make a decision for yourself. However, birth is a journey, and sometimes we need interventions that we did not plan on. No matter how the birth shifts, many of your preferred choices can be upheld throughout the process.